everyone. Jim, are we good to go?
Yes, you are.
Thanks, Jim. Hi, everyone. Welcome to the Colorado Health Foundation's Patient Portal Learning Community Celebration webinar focused on sharing best practices for patient portal sustainment. Most of you know me by this point, but for any new folks, I'm Dara Hesse. I'm a Senior Program Officer on our Healthcare and Health Coverage team at the Colorado Health Foundation. I will be your facilitator for this last and final patient portal webinar. But before we get started, I'd like to go over a few housekeeping items which we generally go through. Our webinar today is being recorded so that others who could not attend can watch the presentation later. As always, we'll post the recording on our Dropbox site, and I'll send that out shortly, sometime later this week or next week, with a link to the recording. In order to minimize background noise, your phones are muted in a listen-only mode during the presentation. However, please feel free to ask questions at any point during the presentation by using the chat dialog area located on the lower left-hand side of your screen. The final portion of our webinar will be devoted specifically to Q&A. For our presenters today, when it's your turn to present, please press *7 to unmute your phone and then *6 to remute when you are finished. And I know that Jim has put some chat instructions, some instructions for muting and unmuting in the chat box on your lower left, on the lower left-hand side of your screen. For everyone, if you're having any technical difficulties during the webinar, please call ReadyTalk's toll-free technical support number at 1-800-843-9166. That's 1-800-843-9166, and make sure to have your registration confirmation number available. And finally, after the webinar has concluded, you'll have the opportunity to give us feedback through a short survey. We ask that you please do take a minute and complete the survey. So I wanted to mention up front that we have a very full schedule of presentations, but we'll be fine on time if everyone keeps to just 2 to 3 minutes, so please keep that in mind. But before I turn it over to Dr. Jim Myers, who will be leading us through the presentations today, I wanted to quickly thank each of you for your commitment and dedication to your portal projects and for being a part of this initiative. Your active participation in these webinars and really your willingness to share the good, the bad, and the ugly with your peers has been so appreciated, and many of you have commented on how helpful learning from each other has been. Finally, I want to thank you in advance for working with Vantage Evaluation on completing the final evaluation request. Evaluation activities will complete this year, even for those with no-cost extensions, and we will be sharing our learnings and other resources with you in 2017 and are very much looking forward to being able to do that. So thank you. I greatly appreciate it, and if you have any questions, you can always reach me via phone or email, and at that, I will turn it over to Jim. Take it away.
Hi, everyone, and welcome to our last webinar. And let me just echo Dara's comments. This has been a spectacular success, the idea sharing webinar series, and it's because you all have agreed so graciously to present on so many of them, your unique processes and successes, and as we said, the good, the bad, and the ugly. And I think we've all learned so much from you, and it's just wonderful to have also seen the connections that have been made by folks after the webinars, connecting to ideas that were shared during the webinar. So it's been really successful, and also let you know that it's been set up as a model in California with the California Healthcare Foundation and a couple other funded organizations are now using the same idea sharing webinar series concept, and has just been very well received. You guys were the first and have done so good that it's just being used elsewhere now. So thanks so much. I do have a question to start off with from Jessica at Northwest Colorado Health. Do any members of our cohort on the call, 1 or 2, utilize HealthWide's knowledge base? She would love to get connected with you and see how you use it, and if you use the shared decision-making process within. If you do, please indicate in the chat box, and I will forward that information to Jessica that you do participate, and she'll make contact with you. Thanks. And then our presentation order, you can see here, this is the same as I presented to all of you earlier, except for one thing. We added in Juan at Clinica Tepeyac after Glenn, so notice that change. And then just echoing what Dara said, making sure that you all think about sort of a 2 to 3 minute time frame. I may ask a couple of questions in addition to that, but I think if we stick with that, we'll be in great shape with time today. And then if you have any chat or any questions, feel free to throw it in the chat box. I'll look for that. I may wait until the very end to interject the question, or may choose to just put it in right then. So go ahead and send your questions into the chat box, and we'll coordinate that for you. And first up, Stephanie from Northwest Colorado Health, *7. Stephanie, are you with us? Let's see. Yep, you're with us. *7. We still can't hear you. All right, let's go ahead and move on to Camilla.
Oh, okay, can you guys hear me?
There we go.
There we go. Thank you. Sorry.
We were going to come back to you. I want you to know that.
Oh, I love it. Okay, so I am probably going to do us a disservice on presenting. Jessica was actually going to present, but she is flying to a conference as we speak. So I am here in replacement of her. And I was actually the lead on the grants, but Jessica did all the work. So I'm sorry if something I'm saying doesn't make sense. But the best practice that she really wanted to share was the data extraction and reporting. She worked incredibly hard on this, and she actually pulled a lot of things manually, and it's something that is not sustainable on an ongoing basis, but the simple reports that she created we are sustaining, simply because it was so valuable to be able to dig in and see how each provider was doing, and then we could really kind of address that individually, and then also just to see our trending. I think our trending was really valuable, and to be able to show that to all of our interested stakeholders and our staff to say, look at what you guys are doing is really making a difference. We tracked what you're looking at right now as messages in through the portal and then messages out. So we basically were able to identify Dr. Hornan was kind of our walking best practice, her and Dr. Lundeen, and we really worked closely with them. Dr. Lundeen was our portal champion, and actually since last month, this has gone up for one of our other providers into the same 30s and 40s range that you're seeing here. So being able to have that data to show providers and to show their teams is really valuable. And then if you want to go to the next slide.
Before we pass to the next slide, just to indicate here, this type of data helps you to identify, as she's mentioned, your champions. And so a lot of folks in their sustainment are trying to identify these folks who are actually using it. To the extent that you see there, the differences between the providers, and then relying on those heavy users, those champions, to then speak to the other providers on the real benefits of it. So great use of data.
Yeah, and more fortunate because one of our champions that was listed there is our medical director, so she does have a little bit of pull with other providers. And then these next two slides, the lower one is the provider in and out again, so it's just trended. So you could see month 8, the messages coming in and out through the portal are substantially have increased, and they continue to increase. And then lab access was actually the biggest use of our patient portal as we jumped into this, and that has grown, and again in September grew again. So being able to see this trend, again, is so valuable, just to be able to see what the efforts are actually making a difference. And we always kind of try and couple data with a story that supports the data. So we would, when we shared this with staff, we would basically say, and listen to how this person was able to figure out that her child was sick and needed to get an appointment, or X, Y, and Z, when you're sharing the data with staff, because those personal touches make a difference as well. And then real quick, not on the slide, really our best practice and the thing that made this most effective, which Jessica wouldn't say, but I'm going to say, was having her and having a grant and having a person dedicated to this, because there's so much going on in our clinics that there's no way we could have done this without a dedicated body or person owning this process. So that's it.
Perfect. Thanks so much.
Yeah.
Next up, Camilla.
Hello, everyone.
Hi.
My name is Camila. I am from St. Joseph Hospital from Bruner Family Medicine. Next slide. Okay. Our best practice that we're sharing is that I'm being pulled back from the front line to obviously do a different role in the clinic. And prior to me taking care of my chart, it was the MAs. It was the role of the MAs. So our MAs do check in on our patients. It's called in-room check-in. So instead of them being checked in on the front, every MA takes them to the room and completes the in-room check-in. So part of the workflow during our check-in process is to ask the patient if they'd like to sign up for our online portal. So the role of patient portal MyChart sign-ups will go back again to the MAs. Now, we have about 18 medical assistants. They've been trained. It was their prior role. Now it's basically going back to them, doing the MyChart registration. Now, the good of this, our medical assistants were already used to this role prior to me coming into MyChart. The bad is it's fully back on them now. So it's them getting used to doing it again. One positive thing that I have noticed within the past month that I have not been doing, as many sign-ups anymore, is that many of our OB patients that are actively using MyChart are asking for proxy access for their babies. So it's something that automatically patients are now, I want access for my baby now. So it's a very good thing. And that's it.
Thank you very much for that. And next up is Brad at Rocky Mountain Youth Clinics. Brad is on the participant list, so you're on, so we're trying to get you on mute. Let's see, *7. Still can't hear you, Brad. Brad, not picking you up. You might be muted on your end, in addition to doing the *7, unmute your phone. And I'm not picking you up still, so Brad, we will come back to you. Let's go ahead and move to Taylor. Taylor from Doctor's Care, can you *7? Dara, can you hear
hello?
me? Okay. I thought maybe I was the one who was messed up here. Hi, is this Brad?
Yes, this is Brad. Can you hear me?
Hi, Brad. We got you now. Go ahead.
Sorry about that.
That's all right.
All right. So just flip on to the next slide. I'm with Rocky Mountain Youth Clinics, and our best practice is, so sustainability is actually a very interesting topic for us at the moment because we're actually in the process of switching over our EMRs and thus switching over our patient portal. And so one of our key challenges is figuring out how to make sure that all the work that was done during this grant moves over to our new EMR integrated portal with Athena Health. And one of the ways that we're doing that is to ensure that the data that we're collecting is really integrated into the organizational metrics that we're looking at to determine the health overall of our clinics. And so Athena actually has this really neat feature called the Sentinel Metrics Dashboard that allows us to look at organizational metrics sort of across the board to determine how well we're doing on our new system, but sort of across the board. And so these metrics include things like post-visit documentation rate, same-day encounter close rate, accounts receivable, like really high-level financial and clinical metrics. And one of the things we decided to do is to make sure that our portal adoption rate, because we're having to resend out invites and make sure that we're capturing our percents as far as portal adoption is concerned in the same way that we were on our past portal, is something that we're looking at constantly. And so this is the first portal metric that we have on the dashboard. We're considering others without making the dashboard itself too large, because if that's the case, then it really kind of ceases to be a dashboard. But really sort of cementing with the executive leadership that making sure that we're making progress and holding ourselves accountable to best practice standards on pretty much a daily basis is one of the things we want to make sure that we're able to do. I know that a lot of the organizations out there have challenges getting data related to their portal. We did as well. I think we're probably going to get a little bit more streamlined and consistent data with our new system, but it's still sort of a challenge to make sure that the right people are looking at it at the right time. So having it stuck on this dashboard, this executive dashboard that our key executives will be looking at on a daily basis to assess the overall health of the organization, and having a portal component to that, I think, is really going to drive continued conversations around how we are doing with the portal sort of writ large. And that's basically our spiel.
Thanks so much, Brad. What a great message. I can't emphasize enough the return to the kinds of reporting that you do at this stage as you build Sustainment to move past the grant period. Building reliable information, data that is trusted about the portal, that's the first step. You're showing data that people trust to be true. And making sure you do all the background review of mapping to make sure where these numbers come from are appropriate. One of our clients this year in your cohort found in the past couple of months that they weren't getting credit for logins and messages sent. So returning back to the analytics programs that you use, they may be embedded with the portal vendor themselves, or you may be using other products. But making sure the numbers are correct and then showing them and getting them in front of senior leaders as you go past the grant period. And by keeping the numbers in front of your senior leaders, then you'll have the attention that you want. So, Brad, thanks very much for that. And,
thank you.
Yep, thanks again. Taylor, you're up next. Star 7, Taylor. I don't see Taylor's name on our list, so we're going to move past doctors right now and see if Glenn, you wouldn't mind joining us next.
Hello?
Hi, Glenn. We can hear you.
Hi. So yeah, my name is Glenn Beck. I'm the project coordinator at the Colorado Coalition for the Homeless. And one of our things is since Go Live, our pharmacy was a huge kind of push with us. They really jumped on board, and it was kind of a huge driving point for the patients as well to renew their medications through the patient portal. And so the pharmacy encourages and helps enrolls patients into the patient portal so they can refill medications versus calling in and leaving voicemails. We also have kiosks set up in our clinic near our pharmacy. So instead of the clients waiting in line and waiting in line to talk to the pharmacist, they can just go onto the kiosks and renew their medication straight from the patient portal. And then they get a kind of an email back, and it usually is filled within that 24-hour period. And those kiosks are also located by our front desk staffs. So the front desk usually is people that push or hand out the tokens to enroll clients into our patient portal. And then having that kiosk right there, it kind of encourages everyone to just get that token and go right over to the kiosk to enroll into the patient portal. But again, the pharmacy and just kind of pushing that medication being refilled is a lot quicker process than just going in and leaving a voicemail, and again just trying to pronounce the medications names and all that. They can just go in there and easily click a button to send in those refills. We also have flyers that we put into the medication bags whenever the pharmacy is handing out their medications that shows how to enroll into the portal and get logged in and how to renew their medications through the portal. And again, it's just one of our number one reasons why a lot of patients are using the portal. And so we're just kind of keeping that, and that's kind of like our big selling point moving forward whenever we talk to patients about the patient portal.
Great, thank you. I think it's a wonderful story about building off of success. Tom and I have brought a lot of resources to you and ideas to you, and we've brought a lot up on these idea sharing webinars, but we all know that what really matters is within the culture of our own clinic what works. And when you see something really taking off, then building off of that. This was a great example here of how they found that the pharmacy was really a magnet for folks who wanted to use the portal and have built off of that. So what a great practice to share. Thanks very much.
Thanks.
Yep. And next up is Juan from Clinica Tepeyac.
Hi, good afternoon, everybody.
Hi, Juan.
So my name is Juan, Health Promotions Program Manager at Clinica Tepeyac. And what we're doing for the sustainment of the patient portals that we have, we've moved the patient portal activities so that they're ongoing to our ECW committee. So that's the eClinical Works, that's our electronic medical records. And what we do is in that committee is we have a lot of people from the clinic in this meeting. So we have our data and quality manager, our clinic manager, our IT support specialist, we have our enrollment specialist, our lead medical assistants, the provider, director of behavioral health, patient health educator, promotora. So it's a key individual from almost each department. And what this will help is for us to be able to give these updates of how the portal is going and to have feedback provided to so that we can continue making this a success. And what we plan to do is having 4 super users for the patient portal. So having the IT support specialist, the call center agent, the lead medical assistant, and an enrollment specialist trained to do a lot of the either troubleshooting or guide the rest of the staff if they have any questions on about the patient portal, that they'll be able to help out the staff. So there'll be more people involved to help with questions or to get to help out the providers if they are having any issues on replying on a message. And this the patient portal is going to be set up on the agenda for each time we meet, and we meet every other week. So we're going to continue with that. I'll still be part of it, and they'll be the key players to provide feedback and how we can improve any issues.
Thanks, Juan. It's a great example here of using an existing committee. So as we conclude the grant period, we take away maybe for some of you the team meeting, the patient portal team meeting, but finding where it would naturally house in an ECW committee meeting or an IT meeting or a QI meeting, and then making sure that the senior leader at that new committee meeting is getting data reports that they want to see. So I know that our teams have been using lots of different graphs and data, but maybe tweaking it just the right amount for the leader in this particular case of the ECW committee, finding out if the data that you showed during your portal team meetings is the same data they want to see in the same format. And then always kind of pushing for who do they report to, and how do you get the information about portals up into the C-suite and possibly into the senior leader meetings as well, to keep it all in front of them, keep the patient portal data sort of fresh in front of everybody each month. But these are great examples here of finding super users and finding the right meeting to do the continuing work with the patient portal. So thanks very much, Juan.
Well, you're welcome. Thank you.
Yep. Melanie, you're next.
Hi, Jim. Hi, everybody.
Hi.
So I'm Melanie Sisson. I'm here from Mental Health Center of Denver, and I got the privilege of leading our grant implementation team. And so in terms of our lessons, for us, I think it's less about the specific features becoming available and more about how we manage the project planning and sort of how we think about how we structure our efforts carefully and ambitiously, but in a way that's achievable. And so what that means for us is paying sort of more explicit attention, I think, to some of the more strategic elements of what we want to accomplish in the course of a given year. So for us, what that means is we look back over our last year and said to ourselves, we did some things really well, and we did some things that we would like like to improve upon, and we can't do it all, right? So we need to have some measure of restraint. And we looked at what the sort of biggest successes for us were in terms of providing things that we thought were really useful, not just to the people we serve, but also to staff, and also ideally kind of cool, right? So I think on the last webinar I got the opportunity to talk a little bit about our integration of our assessment tool, the Consumer Recovery Measures, which is a survey, directly into the My Health Point portal that we use. And this is useful because it is an assessment tool, and as we all know, people working on their way towards recovery benefit from having these regular check-ins with themselves and saying, how am I doing today? How am I feeling about my safety and security and prospects and health and well-being, all of these dimensions. And we were able to incorporate those data into our clinical interactions directly through the portal. So it was useful to staff to be able to have that regular data inflow. So the idea with that was to use the portal not just as a sort of unidirectional push of data, but also as a way to receive it from the people that we're serving. It was also really cool because the interface was slick and you could push buttons and there were colors and you got immediate returns on your responses and all of those things. And so that's been a real big success for us. So our lesson moving forward is to have sort of that restrained ambition and to identify what is that next one big thing like the CRM that we can continue to sort of hook both the people we serve and our staff with in order to get that level of adoption to continue to increase. And so in our planning for this coming year, we decided our next big thing is the integration of a consent portal with CREO, the Colorado Regional Health Information Exchange Organization. And so we're working with them to create an interface through our portal for the people we serve to provide consent for information sharing through CREO to other selected medical providers. So to us this feels like a potentially really big win, not just sort of in the direct interaction that we have with the people we serve, but also in terms of expanding the sort of therapeutic sphere and sharing information that can really contribute to their care and health and well-being throughout the provider community, not just here at Mental Health Center of Denver. So for us, again, it was the sort of concept of being really strategic in our planning, not being overly ambitious, but just ambitious enough and picking that one big thing to do and to try to do it really well.
Wonderful. You know, this is another great example. I think we're going to see more and more the patient portal. You know, we think of marketing and pushing the portal, and I think what we're going to see in the future is more and more of pulling the advantages of the portal into other initiatives that are going on. And this is a great example here of setting up, a consortia consent. We may find follow-up for Million Hearts or the phase programs that are out there around hypertension or depression screening, and finding that the portal is a great option for some of the providers to take that next follow-up step, to not only take it and do it successfully and reach out to those who might best connect with their providers through a thing called a portal and maybe their smartphone, but also to then achieve our population health efforts underway, our accountable care organization, PCMH, kinds of things that value-based reimbursements might be based on. So we're hearing lots and lots now of stories of folks reaching back to the portal and saying, oh my gosh, that's a great resource to be able to do our next step for that particular effort underway. So great examples, Melanie. Thank you for your progressive approach to the portal and the use of the portal throughout this past year. And your comments today. Thank you.
Thanks very much.
You bet. And Hannah at Sunrise. Hannah, I'm looking up and see if we have Hannah on the participant list. *7, Hannah.
Can you hear me?
We can now. Thanks.
Okay. I hit the wrong button. Sorry.
That's all right.
Hi, I'm Hannah Gallagher. I've spoken a few times, so everybody's probably heard me so far. I think one thing that we wanted to talk about is the patient portal is one of those things that's really easy to get lost in all the priorities of any organization, and so we were trying to find a way long-term to keep the portal on the radar of a lot of different people. And originally when we were launching the portal, it was incorporated into our meaningful use meeting, which had a lot of, I think, really important and good people in the room during that time. There was a medical director and our IT director and quality improvement, but we decided to switch it, moving it into the EHR admin meeting. And I think that one reason that was hopefully going to be beneficial long term is that included a lot more providers and people in the clinical side of things, as well as our IT support. And so I think that long term that matches our vision for the portal, that we really want this to be mobilizing people in a lot of different departments. And the EHR admin meeting just had a lot more of those people sitting in the room. And so I think that originally our focus was just how to get this thing started, and now we want to switch our focus more onto new functionality and support of the new portal tools. And so again, that's better supported in that. I think the good of that is that we can start focusing more on some of those finer details of the new tools. So again, if we're looking at, we rolled out the messaging providers, and so now we can start looking at what those details of the workflow would be, and therefore we have clinic managers in the room, we have providers who would be receiving some of those messages, as well as triage nurses who might be triaging the messages. So we hope that that will help long term. I think that the bad so far is we switched, it's been a few months ago that we switched over, and it has been difficult to work ourselves into having dedicated time for the portal, because one downside to switching to that meeting is that there is a lot of different issues on the table that need to be discussed in that hour and a half to 2 hour time slot. And so I think that long term we're going to have to figure out the best way to make sure that the portal does get enough time in that meeting, and that it doesn't just, again, get lost in the noise of all of the other priorities. So that's it.
Thanks so much. And you were always there for us when we had to need to go to folks to present at our webinars. You've done so many of them. Thanks again for all that you've provided to this group.
Sure.
Yep.
Thanks.
Take care. And next up is Catherine at Kids First. Catherine, are you with us? Looking up at our list. I don't see her on the list right now, so we'll move to Tragon. Can you join us? And Tragon, I know there was a question about whether he was going to make it today. So I will then ask if anyone else is on the call that had slides that has not been called on yet to go ahead and star 7. And I will speak for Catherine while we're waiting. One best practice that at Kids First is this: every patient's given a chance to use the portal and automatically enrolled. So they're doing a more proactive enrollment process, getting folks before the medical assistants with the check-in with them already pre-enrolled. I'm now reading in front of me, trying to remind myself of exactly where the bad side of that was. Some folks, I guess, don't have their email addresses and aren't willing to give those. Still take a lot of standing over people's shoulders to implement. I know they have gone back and forth about the pre-enrollment process, and I know they've continued to see both the good and the bad. And I know many on this call have tried this process as well. And now I will ask if anyone else is on the call that has not already been called upon to present today. I think we had Taylor as well. And I think we have now reached the point where everyone has presented that's on the call, and open it up for questions and answers for our presenters today. You can, again, welcome to put something in the chat box. We have hit the really big, important parts today. You can hear some major themes that have come up. The continuation of the general approach to portals is to have a strong team, to have good data, and to recognize your true champions and those things that are working within the culture of your organization. These are the big lessons. All of you have learned them, and all of you have shared today different ways of approaching each of those. I think what we'll see predominantly in the future, just over the horizon, is more requests for the kinds of data that you're showing on portals, what pages are being hit, where most of the activity is happening, and not just on enrollment and active use. And you'll see that blossom over the next couple of years. We know that from folks who have had patient portals for 3, 4, 5 years now. Also recognizing that over the horizon, you're still looking at, in a traditional sense, about 30%. Now we're starting to see 40% of populations in the more progressive nonprofit and for-profit organizations that use portals. And that's a pretty interesting saturation. It's not 50% yet, but it's a lot more. But the growth is growing faster now. The percentage is moving up a lot faster as it's connected. The use of the portal is connected to these more value-based progressive approaches to healthcare that we're seeing come over the horizon and that many of us have been working on now for changes in reimbursement in our clinics. So I'm now looking in the chat box. Don't see any further questions, so I will thank you all again for your participation. It's been a great grant period and a great learning experience for all of us, and I've enjoyed working with all of you on these idea sharing webinars. And now I'll turn it over to Dara. Dara, can you hear me? Let's see here. *7. I hear the click.
There, can you hear me now?
Yes.
Sorry, I realized I had muted and *7, so I was talking for a while. So thank you so much. I just wanted to say one more time how appreciative we all are here at the Foundation for your participation, not only in this funding opportunity, but also your active participation in the peer learning community. And again, your willingness to share resources and information and lessons learned, it's been really, really beneficial. And I also wanted to say once more that, if you have any questions as these grants wind down about what kind of we're going to be doing with the evaluation data, or if you have any questions about the evaluation or really anything else, please don't hesitate to give me a call as you're completing your final reports. If you have questions about that, I just really want to make sure you know that my door is open and I'm here to answer questions that you might have. So I just really wanted to thank each of the grantees who shared today. And for everyone who shared on past webinars. And Jim, thank you for your dedication to this project and for leading this idea sharing webinar series. And to Rose as well, Rose Green here at the Foundation, who was instrumental in providing support behind the scenes and getting all of these webinars set up. So it's just been such a pleasure working with you all. And you have the gift of time to enjoy and or be productive for the rest of the day. So thanks so much, and we'll talk to you soon.
Thank you, everyone.